biology. This is a 10-minute video on primary care and specialized care. What is primary care and what is specialized care? So, what we will learn in this video is the difference between primary care and specialized care, and we will learn what a specialist does differently from a primary care provider. We will also learn what areas specialists can fall in outside of primary care. So let's go on with our 10-minute video today, learning about biology and primary care as opposed to specialized care and professionals that provide that care. Let's begin with definitions. PCP. PCP stands for primary care provider. PPO. PPO stands for primary plan option. So what PCP says is that primary care provider says that you need a PPO, a primary plan option. That means that the specialists inside of your primary care doctor's plan all are under the same association, and the money stays within the same provider. And so you have your PPO, your primary plan organization, and you have your PCP, your primary care provider. And he or she wants you to stay with them under their primary plan option. Now, a PCP is going to be what we call an endocrine doctor, or an eyes, ears, nose, and throat doctor, or a family doctor. And these doctors are all one and the same. Whether you call them an endocrine doctor, whether you call them an eyes, ears, nose, and throat doctor, or whether you call them a family doctor, or rather you call them a PCP, primary care provider. These doctors handle primary care. That means they are able to do checkups, and they are able to make sure that you are safe and you are within vitals, and there are no specific areas of care needed. And I said, well, okay, what does that really mean? That means that if you go to your PCP and you tell your primary care provider, the eyes, ears, nose, and throat doctor, that something is wrong with your mind, that doctor cannot help you. she's not trained. She's not trained to help you. What they can do is refer you to a specialist, a psychologist, or a psychiatrist if it's your mind. And they can help you. They are not trained in the area of psychology. They did not major in the area of psychology. Do they know about psychology? Yes. Do they know about health? Yes. Do they know your mind needs to be healthy? Yes. They did not major in this area of psychology. So they would have to refer you to a psychologist or a psychiatrist, and it has to be within their PPO, their primary plan option. That means people that work with them. In order for you to get the benefits that you think you're getting. If you go outside of the benefits that you think you're getting, well, that comes with their people. But if you go outside of your people, you're going to have to pay. Now, let's move along. You go back to your doctor and it's a checkup, and you know what? You just had a baby, and the baby is not in its percentile. The baby is functioning at a lower level. It should be talking, and the baby's not saying any words. So you go to a pediatrician that, again, the PCP can handle, the primary care provider can handle, until it is assessed that this child needs something other than what the primary care provider can handle, or this adult, the primary care provider will continue to assist and try to meet the medical needs of the consumer. However, when it is x-rays and there are assessments that show that it is out of the realm of the care of a primary care provider, that means your family doctor, they need a specialist. And a specialist is where we go when it is out of the realm and the care of just a checkup and just a refill. So, if it is a child that is born with spina bifida, they're not going to refer you back to your primary care provider. They're going to refer you to a neurologist. And these are people that deal with the nerves and the spine and the mind and all the medicines that go with that. So if it's a mental disorder, they will refer you to a psychiatrist. And the psychiatrist will prescribe all the medicines that go with that. So, when it's just about the human body and there's not a specific area on the human body, they do not have to refer you out. And this is where you get your referral plans, where you go to your regular doctor and the regular doctor says, oops, I can't do that. And they can give you authorization to go somewhere where someone who has went to school to do that. So, that being said, let's take it up to the macro level. When you learn science, everyone's not equal. Some people decide that they want to work with families in primary care and educate families in primary care and help keep people as healthy as they can in primary care. And then there are some doctors that say, you know what, I am a specialist. I specialize in the feet. I'm a podiatrist. And there are some doctors that say I specialize in the mind, I am a psychiatrist. And there are some doctors that say, you know what, I specialize in women's health and I love delivering children. I'm an OBGYN. These are all healthcare preventions that are outside of the realm of what we know to be PCPs, primary care providers. So anything outside of that, we consider a specialist. Who? Biology.